Inaccessibility to care, negative patient experience, staff burnout, inefficiency, and medical error are just a handful of problems that medical facilities across America inadvertently promote. In an effort to utilize design to combat the issues that plague healthcare facilities today, our project goal was to apply human-centered design in the creation of a physical environment that promotes health and well-being. Our project is in response to one of Des Moines' larger urban medical centers, which is looking for a suburban community to build a state-of-the-art micro-hospital and serve as a satellite location. The primary goal is to provide convenient access to services closer to home. Outpatient growth is expected to continue to grow, so the site may allow for future expansion of the clinic if needed. The site must also include a helipad for emergency transfers to Des Moines, a healing garden for patients and staff to utilize while on campus, and the hospital is also adding a new psychiatric emergency department to meet the needs for mental health support in Iowa. Radical convenience for patients, employee engagement, and sustainable growth are among the hospital's top strategic priorities. In the creation of Affinity Health, we believe in the power to heal. Our team has found that there are 3 foundational points to reach this goal, and they are biophilia, safety, and efficiency. Research through evidence-based design was a fundamental step in order to reach our main goals. First, our research on biophilia concluded that daylight and views reduce stress and anxiety, and biophilic elements served as positive distractions which facilitate recovery and mental fatigue. The outdoors are even more effective than indoor spaces for restorative benefits, so programmed outdoor space is a must. Evidence proves that falls and injuries in hospitals are huge expenses, and ways to prevent this include good sightlines, visual acuity of surfaces, and sufficient lighting. To avoid violence or risks in the ER, it's important to make all public in direct lines of sight with the staff. It saves much more money for a hospital to be efficient and schedule as many patients as possible, as well as creating better workflows with a layout for effective work. Avoiding staff burnout by facilitating spaces of interaction is also imperative for increased productivity. Defining public and private space protects privacy and confidentiality, as well as creating more efficient circulation routes.
To start our site research, we first jumped into statistics about the town of Norwalk as a whole. The town is home to roughly 12,000 people, with 87% of the residents living within the urban fabric. The town has grown a considerable amount since 2000 and is expected to grow gradually over time. The average income per household is about 20,000 more than the US average. This town also has an average resident age of 35.9, which is slightly older than your average Iowa town, with most coming in around 33. We then began to analyze our specific site located within Colonial Circle in Norwalk. We first looked at the roads in gray, the pedestrian trail shown in color, and the traffic counts coming from Sunset Drive, the main road just to the east of the site. Our analysis continues by identifying important programs such as food, retail, and healthcare facilities in existing buildings near the site. We also pinpointed the locations of public parks in the area. Next, we dove into the topography and drainage near the site, as well as the vegetation there within Colonial Circle. Following that, we identified the south and the north to be the 2 directions that the wind is typically coming out of, and we were already familiar with the sun path due to the site being so close to both Des Moines and Ames. And the last thing we looked at was zoning on site. We found that Colonial Circle falls under the town center commercial classification, so we made sure to take setbacks and other code-related elements into account throughout the design process. Jumping into our micro-hospital's massing, we started this process by first taking a look at programming and the many important adjacencies we needed to establish within the interior. Next, we chose to soften the edges and corners of the mass to give it a less intimidating form, as buildings with sharp edges and corners can give patients anxiety. We then created a central void which could act as a staff-accessible courtyard. Using clear stories, we were able to emphasize important corridors and public spaces while bringing indirect light into those spaces. We established entryways and garage locations by vertically increasing the volumes for those locations. We then chose where we wanted to locate the glazing upon the facades, while taking into consideration the potential angles of the sun. Vertical fins were added in key locations to help regulate interior lighting. And lastly, rounded cantilevered roofs are added to the mass.
As we are working on designing the site, the same drivers of safety, efficiency, and biophilia guided the master plan. The building was placed on the site to maximize views out for inpatient rooms and to create a vehicular circulation that minimizes patient exposure to the Iowa climate. The site's main spaces can be broken down into parking, patient gardens, and emergency vehicle spaces. The orientation of the spaces responds to the appropriate programming on site or adjacencies within the building. Within the parking on the site, the circulation can be broken down into 4 groups: ambulance, walk-in emergency, clinic, and pedestrian. As you can see here, there's a main split between emergency and clinical parking, with an internal link for any spillover or traffic needs. The proposed vegetation on the site consists of varying heights and textures. These 3 typologies of plants, lawn, meadow, and woodland, carry throughout the site's spaces. The meadow areas would be planted with native prairie grasses or other shrubs. Lawn would be a typical turf, and wooded areas would be varying trees and shrubs.
After determining our desired programming for the micro-hospital, figuring out adjacencies were key in order to maximize efficiency. Diagnostics needed a main presence in the hospital in proximity to all other care departments, while inpatient needed to be accessible for visitors yet have access from the ED. Clinic and food were to be off of the lobby for casual visits, while ED and psych have a separate and less public entrance near the ambulance route. Staff-only circulation has an unobstructed route through the hospital to maximize efficiency and privacy. They have access through the service entrance, staff lounge, staff parking, and to the interior courtyard. Unaccompanied patient circulation is easy to navigate with short distances from the lobby and wide sightlines. Unattended access is available through just the 2 main entrances for safety reasons. Shared circulation occurs when patients and staff must be together collaboratively, and shared routes are the most efficient. Shared entrances include inpatient access to the outdoor garden and the ambulance entrance. It's important that similar spaces be distributed throughout the hospital to maximize convenience, which can be seen in the service spaces and staff support. The floor design is intended to help define space and wayfind throughout each department. Curved regions designate spaces to break up the large lobby. Lines lead patients and visitors from one corridor to the next while maintaining the soft, curvilinear forms of the hospital. Both contrasting and complementary colors are used for clarity, safety, psychology, and wayfinding.
This diagrammatic section allows us to start to see the prioritizing of volumes within the project, featuring clear stores in main areas, in this case, the corridor just inside the ED entryway. We can also see the staff accessible courtyard and how the emergency parking lot is pushed up towards the building for when patients need immediate care.
We designed the lobby with a cafeteria, childcare, general offices, and public area. A childcare area and reception desk face the entrance directly to give the first impression of our building to the public. The general atmosphere of the lobby creates a welcoming and engaging space with a sufficient amount of natural lighting. Moreover, the butterfly terrarium behind the reception desk can be the focal point of the hall. The combination of natural lighting and inner green space would be a positive distraction to ease the visitor's nerves.
We chose to locate the food and nutrition department at the front of the building so we could tie it into the public lobby and create a welcoming open space, as well as give the users an option to sit and eat outside in the patio area. A loading zone was situated on the northwesternmost side of the building and serves as the building's primary receiving space. The spaces that are meant to be staff only are thoughtfully designed to be as privatized as possible, so the staff members also have a sense of solitude here in the food department.
When you look at the emergency department, there are 3 entrances in total. Walk-in entry at the lower right, both ambulance entry and human decontamination entry at the top. The garage from the top of the building will be a guidance for the rescue workers. Also, most of the treatment rooms are facing the nurse station, so it is possible that caregivers take care of them. Also, the corridor nearby the nurse station guides patients from the emergency department to the inpatient services if they need to be hospitalized. Finally, the bottom part is public space. The purposes of the family room and communication center are for the families. Just they can have moments to converse their family's condition with doctors or staff and to comfort themselves. Then the public can access to the building's lobby through the door between the family room and communication center. This is the psychiatric emergency services. The space is divided into 2 purposes. The upper rooms are for the patients who need to use psychiatric services right away from the ambulance entry. Then the lower rooms are more for outpatients, the public, and caregivers.
The clinic is set up as an on-stage, off-stage model to maximize efficiency and travel time around the clinic and provide privacy for both staff and patients. Offices line the back wall of the clinic for privacy and proximity to the staff break room and staff entrance. The clinic room is set up for caregiver entrance and patient entrance. Along with the exam table, there's also a consultation area at the table for patient dignity. 3 zones organize the space to make the small room more efficient. Adjacent to the clinic is diagnostics with a shared entrance and break room that continues along the staff corridor. This department is also set up as an on-stage, off-stage layout with separate staff access at the top of each diagnostic room to access the hall of imaging offices and lab. Patients are equipped with an efficient area to access their room without the anxiety of exposure to many machines and testing areas.
Zooming in on the inpatient department, you can now see that the 7 patient rooms wrap around the exterior of the building, giving the patients a strong sense of connection to the surrounding landscape. A water feature is positioned just outside the department in order to help maintain patient privacy.
The patient room is divided into 3 spaces: the caregiver zone, patient zone, and family zone. Patients have privacy with the bed being against the front wall, yet it still has sight lines to caregivers at the nurse's station. The patient view is unique in that it has visual access to the outdoor pond and garden, yet still has wall space for a TV. Proximity of the patient bed to the bathroom is important in terms of safety and reducing falls. A hand washing station by the door encourages caregivers and visitors to use it immediately when they enter the room.
There's a public corridor that weaves between the patient rooms and the staff-related spaces, which envelops a staff-accessible courtyard, which is meant to benefit the employees and their own health and well-being, while also giving views to the surrounding staff spaces. The patients and visitors have access to a garden space just outside the building for when they need to get out and stretch their legs. The staff in the inpatient department can also gain direct access to the diagnostics department as well as the psychiatric emergency services if needed. We tried to tie all these together in a way that improves efficiency for the staff and hospital as a whole.
This internal courtyard is a staff courtyard that is not open to the public. The pergola to the west provides a textured light, and the exterior space as a whole creates a microclimate that allows staff members to have privacy and enjoy the outdoors. As you can see here, the staff can use this space to relax, confer, and alleviate stress from the hospital environment. The courtyard has a strong relationship with the lobby's butterfly solarium, and while the staff can see into the lobby space, patients in the waiting area will only be able to see a filtered view through frosted glass. The garden space to the northwest of the building is open to the public, patients, patient families, and staff. Privacy measures are in place to maintain anonymity for inpatient rooms looking out to the gardens. Within the gardens, there are a few different spaces, the boardwalk being the furthest out from the building. The plants along the walk were chosen for their multi-seasonal interest. A combination of pagoda dogwoods and service berries function as an internal divider among the smaller spaces of the garden, while larger trees buffer the parking lot and street southwest of the garden. The rocks within the garden can be used as seating in addition to their value as a texture within the garden. The view of the pond from both the garden and the inpatient room adds a dynamic piece to this healing garden. The changing water conditions will allow patients and staff to see a piece of the landscape respond to the cyclical nature of seasons. The glass on the inpatient facade is mirrored for the patient's privacy.
By taking a closer look at the inpatient facade, we can begin to point out different key elements that are integrated within. With the use of overhanging roofs, we are able to keep direct sunlight from reaching far into the building in the hot months, while allowing more sunlight in during the colder Bible months, which will in turn improve the energy efficiency of the hospital. Using custom Corten steel fins along the vertical mullions of the exterior, we are able to further control the interior lighting, increase patient privacy, and create an organic architectural expression along the facade. The mullions which hold the fins contain highly reflective glass panels that act as a visual barrier from the exterior of the structure while still offering beautiful views to the proposed landscape.
In response to our research and evidence-based design, we will now summarize how we have applied these goals in Affinity Health Microhospital. Examples of this research in our building are clear stories throughout interior corridors, floor-to-ceiling glazing for unobstructed views, custom fins to maximize daylight and minimize glare and heat gain, a butterfly terrarium for dynamic distraction in the main lobby, art and sculptural elements to emulate nature, an interior staff courtyard for a convenient and protected outdoor space, outdoor dining, and a garden and boardwalk loop accessible to patients, staff, and the public. Examples of this research in our micro-hospital include the interior courtyard being a safe outdoor space for 24/7 access, all access points of the building being on the same topography, so walking around the site is accessible, a one-story building so that there's no stairs or elevators, reflective glass providing privacy against the public without sacrificing views, a retention pond in front of inpatient providing a barrier between the public and patients, patient adjacency to the bathroom and sightlines to nurses reducing the risk of falls, exterior lighting for visibility, flooring designed for maximizing clarity through contrasting colors, patterns, and material, a lobby and sightlines to triage and security in the ED, separate waiting zones, and secured psychiatric facility. Examples of this research in our micro-hospital include an onstage-offstage clinic model offering more patient throughput, shared department amenities to save on building costs, staff having many spaces to interact with each other, which reduces burnout and increases productivity, clinic onstage-offstage model reducing travel time to each station, the centralized nursing station differentiating public and private areas, central staff areas allowing confidential conversations to happen without risk of patient interference, and staff getting to functions throughout the hospital without crossing paths with patients.